India's Prime Minister Narendra Modi doesn't call it Modicare, but everybody else does. His ambitious National Health Protection Scheme will be the centrepiece of his re-election campaign.
The poor of the country will not have to struggle when they fall sick. They will not have to borrow from moneylenders. Families will not be destroyed.
The scheme is due to start in late September and will become the largest publicly funded health service in the world. In effect, the government will pay the premiums for health insurance for 100 million Indian families. Each will get a policy that covers their medical costs up to the equivalent of about $7,000 a year. At the moment, only the well-off have access to insurance to pay for treatment in a private hospital like this.
I'm lucky. I don't have insurance, but I can afford this. My husband has a good job. We own our own house.
The new programme will cover the poorer half of India's population. For private hospitals, the scheme should see a big boost in business, but there is concern they'll be overwhelmed by demand. India spends just 1.5% of its GDP on healthcare, compared to a global average of 6%. Facilities and staffing levels in the health sector are poor, but that, say doctors, is changing.
There is a lot of concern regarding the human resources, but I think within 10 years or 15 years, our health sector will be in a world-class health sector.
Some have accused Narendra Modi of caring more for his Hindu base than for other ethnic groups or India's poorest. With healthcare for all, he's trying to change that image. If it's a success, it would be a big achievement. Andrew Thomas, Al Jazeera, Guwahati.